So this piece of work is what I did my master's dissertation for a master's in psychology of mental health and well-being, which I did at Wolverhampton, and I graduated not that long ago, and that was how I ended up being able to see some of you then. So what I was looking at is matrescence, which has mainly been studied in new mothers and not in mid and later motherhood. And I wanted to take into account the fact that we all work within a multicultural context, particularly as Birmingham is so hugely diverse. And the methodology that I used is a qualitative, reflective thematic analysis. So you might ask, what is matrescence? Because it's a word that not an awful lot of people know what it actually is. And so I thought I would share that with you. This word was first coined by a psychotherapist called Dana Raphael in 1975. It didn't really take off for use until fairly recently, and what it is, it's a bit like adolescence, which is that transformational phase in your teens. And what this talks about is the transformations that occur during becoming and being a mother, and it starts really before you have the child, because there are things that go on in the body that happen before the baby is even born, and so it considers things like the physiology, the psychology, the sociology, the cultural environment. All are important aspects of what happens in terms of identity and so forth in this phase of becoming and being a mother. And in fact, if you think about it, once you've been a mother, you're always a mother. It's not something that actually finishes, unlike adolescence, which once you come out of that phase, you're no longer an adolescent, you become an adult. But as mothers, it is something that doesn't finish, because even when you've got grown-up children, they're still your children and they still call upon you at times, and so it's an ongoing process. So in terms of what I'm going to talk about is this reflexive thematic analysis, which was Braun and Clark first utilized in the 2000s, and the paper that I particularly used was that of 2012. The themes within my research ended up being to do with identity, of what it is to be a mother, some of the issues around cultural dynamics, which were very interesting indeed, support networks, and the workplace. And that final point around the workplace is very intriguing and quite concerning, with some of the things that are going on in terms of how mothers are being treated. And even though there's regulations and laws in place for not kind of treating mothers in an adverse fashion, that is just not the case. And some of the newest stuff that's coming out in terms of abortion and so forth is really worrying. And I think it's even worse, far worse in the States, which I looked at some of the literature from the US, and I feel very sorry for women there and not having proper conditions in place for them, and the lack of support that mothers have. So in terms of who the participants were, I did 11 in-depth interviews, and the women that I interviewed were from different cultural backgrounds, that some had children, adult children, and some were caring for parents as well. There were women that were in a marriage or a partnership, and some of them were a mixed marriage with each partner coming from a different cultural background. The major drawback to this is that I wasn't able to do any interviews with mothers that were in a socio-economically deprived backgrounds, and so that one is a particular issue that I will try to focus on, making consideration for what could happen for those women. So in terms of the whole process of doing reflexive thematic analysis, you have your transcripts, and you have to really get to know the data. So familiarization with the data is quite intense, and it means you read through your transcripts over and over again, and get to know it in order to develop your initial codes, and then from those initial codes you develop the themes, and then once you've identified the themes, you then go back to your transcripts again and ensure that they are able to be used not just for one transcript but for each of them, so that there's a continuity and a constancy. And I ended up using the program. I used a program that was very helpful indeed, called Delve. And why I wanted to use something that learn something new. I wasn't wanting to use something a software that wasn't intuitive or that was for rather huge data sets, and this was really it was just ideal in terms of what I was trying to do, and I found it really helpful in the way you could code and recode and then develop your themes, make notes on it, and when you came to write the report, it was very straightforward to do so. So I then came up with overall themes. Then from those themes, some of them had sub themes, and then you went again back to all your interviews again, and then you write up. So it's a longish process, but you're able to do it in bite-sized chunks, and I really enjoyed being able to really get to know the data and formulate ideas and come up with them. I had a supervisor who I discussed things with, and so somebody else to kind of bounce ideas off was really helpful. So I then developed once I had done the thematic analysis, I then came up with a diagram that I wanted to show the different considerations that I taken into account. So in terms of the theory behind this, so for my literature review, I looked at the dark ones around the edge, so developmental theory, positioning theory, post-humanism, and biopsychosocial. So those were the kind of psychological theories that I considered in my literature review. And there was much more that I could have gone into, but given that I only had a short period to do my dissertation, and as I kept on being told, oh, you're not doing a doctorate, you don't need to go into the kind of in-depth writing, and I only had 6,000 words to write within as well, which is actually incredibly difficult when being used to writing a really a long paper. You normally 6,000 words is actually very short, and it means you've got to be really clear and cut out all the extraneous stuff. Oh, how many times I went through editing, I cannot tell you. it was quite something. And here it shows the kind of life course approach that I took, with mid-motherhood and older motherhood being emboldened, because that was the area that I kind of was focusing on particularly. So I wanted to share a few of the quotations that I picked out from my transcripts. And this was one that Savvy came up with. So you're going from that, everyone's together, that multi-generational culture that you've grown up in, and then you're at a transition point because you don't know where that's happening, what's going on to come to you, in that you can't rely on what has gone before. Something new is coming up. And the Savvy was from an Asian background, and so there were many people in her family, and they're all together, and so she had older family members and younger ones all in the mix, and it was something that kept coming up time and time again, was the interrelational dynamics of being in a family. The other thing that I did for each of the interviewees, I created a summary of the interview by using a process that's called iPoems. And so what I had to do, that you go through the transcript and underline anything where the interviewee says "I" at the beginning. And so this was the iPoem for Mari. I didn't use, these are not people's actual name, the women's actual names. They all chose a pseudonym, and this was part of the requirements of the ethics committee, so that people retained their and were anonymous. They felt that the interview was confidential. You had to take into account if they had anything was triggered, you had to refer them on for support, and so that each woman had a letter that they were sent, explaining what was going to happen as part of the process of being involved in the research. And I also sent them their iPoem and shared a bit of the main findings once I completed the work. So this was, as I said, from Mari. I would say, in a way, I was quite lucky. I was in an environment where I was expected to spend 40 days, more or less, just looking after me and the baby and not worrying too much about appearances. I didn't know. I have this imagination that people have to sort of get themselves all sorted out in other cultures. I didn't feel that pressure, but I did. I did feel very leaky. I really value the 40-day rest. I mean, the other side of that, which was the opposite, was that everybody would come to see you. I would need to be properly dressed. I'd take on the role of daughter-in-law within the household. So then when I was pregnant, I'd stopped working and had started to sort of cook for everybody. And that resumed once the 40 days was over. So, and that was one of the things that came from some of the discussions. Mary was actually from a white British background and had married into a South Asian culture, and I think that was something that gave her an additional pressure in terms of the expectations that the dynamics within that family context meant. So she had to do an awful lot of domestic labor, and she found it very difficult. It was an unspoken deal that she had to look after the family and do all the cooking and washing and cleaning and everything else, and the mother-in-law then would have the children to look after. So I think, as you can see from what she says to me here, I was very much in a context where I was expected to do an awful lot of domestic labour. I find that quite difficult because my mother-in-law's the unspoken deal was that she would look after my children while I cooked for her, which really pissed me off. So in terms of what the findings kind of go on to kind of, they do contribute. What I found does really contribute to the matrescence literature, especially as what it does at the moment is mainly focus on mothers who've just had babies, and maybe that they're returning to the workplace, but and the work that I did in this piece of research was to look elsewhere and to kind of think about what's going on when you have older children and what's going on amongst mothers who are part of the sandwich generation. And what I mean in terms of the sandwich generation is women that are looking after both their children and their parents, and that poses more tension, more pressure and stress for those mothers. And so I think from looking at the findings that I had then, from that, there really are valuable insights for considering what is needed in terms of culturally responsive support systems within the workplace and policies that really take on board the lived experience of mothers, and at the moment the considerations for women in this context are not really supported to the amount that they could be. And there's future work that needs to be done as well, future research, because it is not straightforward. There's quite a complexity around maternal identity and how it's not static, it changes, and there are things that could be done to support women concerning that identity in the workplace, which aren't currently not there. And it's not just the women, it's families, I would say, because there are many men who want to be able to support their wives better, but there are the constraints that they're put under mean that they don't really end up feeling that they can do that. So you've got some of the policies that are kind of needed around parental leave, how women and families can get access to childcare, because that is really, it's the flexibility that's needed, which is not the case at the moment. And then there's also things to do with immigration law that shapes maternal experiences as well. And I think we're beginning to see a consideration of menopause and within the workplace, but it's those kind of support networks that that women need, and mothers particularly who've not really had that the kind of in-depth consideration of what's required. And I'm sure that if you listen to women that come back from maternity leave, that there's always issues that arise because there hasn't been a real thought about what needs to be in place within the workplace. And I think that needs to be looked at a national level as well, so that we have more policy focused study to look at structure structural supports, because at the moment there's not supports there. There is very much so an absence of support, and all of that will then improve a mother's well-being, their identity and capacity to engage in both professional and caregiving roles. And I think one of the things that came very much out from some of the discussions that I had was around that, and I think some of the some of the reports that have come out on women returning to the workplace recently have shown this to be the case too, is that often the workplace thinks that they have lost their motivation for the work, and that is truly not the situation. What's more of what's going on is that there is structural issues, that they don't feel supported at all, and so many women are actually leaving the workplace and having their own businesses, because that gives them the flexibility that they need in order to be able to work to support family and be able to drop their kids off or pick them up, or be able to go on holiday at different times and so forth. All of those things that have not really been considered terribly well at the moment, because one of the things that happens during motherhood is that you learn so many competencies that actually contribute to being a good leader, because you have to be able to juggle, you have to be able to work out time schedules and project plan, all of those things. So why wouldn't you not want to use those skills and see the way that they can actually contribute to the workplace?